Ladies and gentlemen, here are my disclosures. I would like to present our study entitled Identification of PISQ IR cutoff scores for impaired sexual function in women with pelvic floor disorders. Assessment of sexual function is typically based on self-administered questionnaires. One of the most popular tools is the Female Sexual Function Index. Still, the disease-specific questionnaire, Pelvic Organ Prolapse Incontinence Sexual Questionnaire IUGA Revised, has no fixed cutoff values until today. Therefore, the aim of our study was to find PISQ-IR cutoff scores for women with pelvic floor disorders. A cross-sectional study was conducted in a group of 457 women referred to a gynecology clinic due to pelvic floor disorders. Medical history was taken, urogynecological examination was performed, the degree of prolapse was assessed using the POPQ system. The subjects also provided information about their sexual activity. They were asked to complete 2 sexual function questionnaires, one general FSFI and one disease-specific PISQ-IR. Out of the study group of women with pelvic floor disorders, 227 women were sexually active and they were enrolled for further analysis. With 88% of response rate, we gathered a group of 200 women and then categorized them according to their FSFI scores, as below 26.55 as sexual dysfunction and above as no sexual dysfunction. Receiver operating characteristics curve was used to test how well PISQ-IR allowed for discrimination between patients with and without sexual disorders. Area under curve statistic was calculated to measure PISQ-IR summary score efficiency in the prediction. The cutoff values which minimize and maximize sensitivity were selected. The groups did not differ in terms of age, education level, parity, marital status, previous surgical history, POPQ stage. Women diagnosed with scores indicating sexual dysfunction had higher BMI and were more often postmenopausal. The groups did not differ also in terms of various diagnoses of pelvic floor disorders. After dichotomizing patients according to their FSFI scores, the PISQ-IR results were compared between those both groups. In all domains of the PISQ-IR, women diagnosed as having no sexual dysfunctions, that is the orange group, had significantly higher results in PISQ-IR questionnaire. The summary score was used as a measure for area under curve statistics. Based on ROP curve analysis, the summary score of 2.68 was determined to be the optimal cutoff for distinguishing between dysfunctional and non-dysfunctional women. The statistical description of the effectiveness of classifying the subjects into 2 FSFI groups on the basis of PISQ-IR with area under curve of 0.85 deemed this case suitable for that purpose. The cutoff score allowed to diagnose sexual dysfunction in sexually active women with 90% sensitivity and 73% specificity. It meant that 73% of the cases were correctly classified as dysfunctional and 90% as non-dysfunctional. Conclusions. Defining the cutoff score for PISQ-IR in women with pelvic floor disorders is an important step in the development of the questionnaire. Thank you for your attention.
Thank you very much. And this paper is now open for questions. And we've got one over here. Thank you.
It's a long walk. Thank you very much for your presentation. My name is Leo from Holland. I wondered, you left out 230 women who were not sexually active.
Yes.
Could it be that they were not sexually active because of their pelvic floor disorder?
I haven't, yes, but most of those people, of assuming if you see about the age of the group, there was sexually, this is higher age, then mostly they are not sexually active. I do ask questions about the reasons for resigning of sexual activity. Mostly it's about 20% who are sexually inactive because of pelvic floor disorders. Mostly these are women that are sexually inactive because of age, because of illnesses and other conditions. But it is difficult to compare results when you have changing groups, when groups change from sexually inactive to sexually active. Because PISQ-IR has two groups of questions. You cannot measure a questionnaire in women who transverse from sexually inactive to sexually active, because formerly they got first part of the questionnaire to fill in, and if they are sexually active, the second part. Then, therefore, unfortunately, that's another study that I did about responsiveness. It's those groups that change their behavior are lost, because you cannot compare the scores.
Maybe I could ask a question. So you've very nicely given us a cutoff. Is there a minimally important difference for the PISQ IR if we're thinking about change?
Yes, I think the PISQ IR is quite a new questionnaire that has, as far as I know, this is the first study about cutoff. And there are no studies about this, but let's hope that with future we'll get to this.
Did you find a total score for the whole questionnaire? Now you had the subgroups. What about a total score for the whole questionnaire?
Well, the PISQ IR questionnaire is calculated differently because Ayuga gave us an Excel sheet for files to input data. It's difficult to calculate the questionnaire by ourselves. Therefore, and the summary score was calculated as a mean calculation sum of all the domains. There are like 21 questions that are put into 6 domains, as here you can see, and the mean calculation of all domains makes us the summary score.
Lovely. Thank you very much.
Thank you.